Good afternoon, everyone, and thank you for joining us today as we give you the update on the COVID-19 pandemic here in Erie County. Today, we have 43 new cases of COVID-19 to report, and that brings us to a total cumulative positive case number since last March of 18,684. We also have a total of 452 deaths that have occurred in Erie County as reported in the NEDS system. The positivity rate for Erie County was 4.9% from March 19th through 25th, according to the Pennsylvania Department of Health. As of this morning, there were 19 total COVID-19 hospitalizations within our Erie County hospitals, and 4 of those people are on ventilators. Last week, we had 16 hospitalized with 1 on a ventilator. So we are watching all of these numbers very closely. Our daily case numbers and hospitalizations appear to be creeping upwards right now. So again, we all must stay very cautious and very diligent, knowing that this virus is far from over. It is still out there looking for its next host. As I mentioned last week, we are monitoring the news reports from across the nation, from across the state, and particularly from those counties that are closest to us as we see upticks there in cases and hospitalizations. So as the vaccine becomes available to you, I encourage you to get vaccinated when it's your turn. We are really in a race against time right now with the vaccine and the viral spread. And there's new news on this subject of vaccine availability, and in just a minute, Shar Behringer is going to report more on this to you. The Erie County Department of Health is also in need of volunteers to assist as we continue to expand the COVID-19 testing and our vaccination clinics. So they are accepting volunteers through the Erie Regional Medical Reserve Corps to assist with the COVID-19 opportunities. The MRC, as it's called, is a national network of community-based groups of volunteers. Both medical and non-medical volunteers are always needed. This is really one of the best ways that you can assist with the fight against the pandemic by volunteering to be part of the MRC. If you're interested in volunteering, you can register using the online portal at serve, that's S-E-R-V, .pa.gov. That's serve.pa.gov. The MRC coordinator will contact you if you're selected for a deployment to confirm availability and provide more information on the nature of that deployment. You can also find more information on the COVID-19 page under Volunteers Needed and on the vaccine information page under How Can I Help, both at eriecountypa.gov. If you have questions or need assistance with registering online, please email mahall@eriecountypa.gov or call 814-823-5205. That's 814-823-5205. And now to talk more about the variants and the newly updated vaccine schedule, I would like to bring on Shar Behringer, the Director of Community Health Services at the Erie County Department of Health. Shar?
Thank you, County Executive. Very good news today. Vaccine eligibility is being expanded in Pennsylvania. In less than 3 weeks, COVID vaccine eligibility will be opened to all people in Pennsylvania. So effective this morning at 8 a.m., what the state is calling priority 1B is eligible. This includes law enforcement, firefighters, grocery store workers, food and agricultural workers. Come next Monday, all of 1B will be eligible. This is for people, it includes U.S. Postal Service workers, manufacturing workers, clergy, and other essential support for houses of worship, public transit workers, any people in congregate settings, working in congregate settings that have not yet been otherwise covered, any correctional officers that have not yet been covered. A week later, April the 12th, we go into 1C. This includes transportation and logistics, water and wastewater employees, food service, housing construction, finance, including bank tellers, information technology, communications, energy, legal services, county workers, not just county workers, government workers, whether it be federal, state, or county, media and public safety, and then 1 week later, on Monday, the April 19th, all Pennsylvania residents will be eligible to receive COVID vaccine. Obviously, that doesn't mean that there will be appointments for everyone immediately, but just the fact that as we receive vaccine and we are receiving a much better supply of vaccine than we had in the past, we'll be able to get that into people's arms as quickly as possible. We know that already there are 71,283 people in Erie County who have received at least one dose of vaccine, and that amounts to about 30% of the eligible people. So that would be people in the county who are 16 and over. So we've got a good start on this, and it'll be exciting to see it move forward in leaps and bounds in the next few weeks. Thinking about the case count, we have actually seen an almost 32% increase in our cases in the last week, comparing this current 7 days to the past 7 days. Some of that we suspect is related to the presence of variant COVID disease in our community. We have 3 confirmed cases. Realize that in the U.S., surveillance is pretty spotty for these variants. And it comes in late to us. It's really for surveillance purposes only. It doesn't really make a difference in disease control at the time that the initial case is reported to us, because we don't even know it's a variant at that time. But what we do know, most of the ones that are circulating so far are the UK. We know that this variant is one that spreads so much more easily than the first round that we know of this virus. And that may very well be contributing to our increased number of cases. That is really all I have this time. Thank you very much, County Executive.
Thank you, Shar. You're always such a great trusted resource for us here in our community, and obviously very good news that you have to report today as the vaccine appointments are going to loosen up for all. The critical role that the health department plays, and we've all seen that over the last year, really cannot be denied. But what does the rest of county government do? Well, we're going to find out more as the month of April comes upon us tomorrow, and we celebrate National County Government Month. So starting tomorrow, be sure to check eriecountypa.gov and our social media channels to learn more about the county, our programs, our services, all the things that are offered up for the residents of Erie County. One such program is the Emergency Rental Assistance Program, which was launched on Monday. You can find information about this at eriecountypa.gov. There's a button right on our front page. But I'm really pleased to have with us today Charlie Barber, the CEO of Erie County Care Management, who is administering this program, and he's going to share details about the program. Charlie?
Thank you very much, County Executive Dahlkemper. Yeah, we're very, very excited that the state and federal government has given to Erie County $17,740,000 to help pay rental arrearages along with utilities that are gas, electric, water, and sewer back to the beginning of March 13th, 2020, when the COVID crisis actually really hit us. And this is to help individual households that have been financially impacted due to COVID-19. Already, since Monday, we have had 603 individuals that have gone to the website to begin filling out the application. The easiest way to do this is to go to ECCM, lowercase, ECCM.org. About an eighth of the way down the page, you will see the Emergency Rental Assistance Program. You click on it. It'll take you to a page that'll explain the program to you. It'll indicate what the amount of money a household is able to make to be eligible for it. It'll explain what the tenant has to provide in order to verify that they have had a financial hardship due to COVID-19. And also, there's two parts to this that the landlord needs to fill out a part. So each area of which has to be filled out will indicate on there whether it's the tenant that has to fill it out, whether it's the landlord that has to fill it out, or whether it's both individuals that have to fill it out. So you can go to eccm.org, or if you're having any questions, we have at least 8 people answering the phones. Call area code 814-923-5512. 814-923-5512. And our individuals, our case managers, will help walk you through it, will help you understand what documents you need, make sure that you have everything ready so that you can apply and be a successful applicant, because we would definitely like to get all this money out to the landlords and to the individuals here in Erie County that definitely deserve it because of COVID-19. Thank you.
Thank you, Charlie. And it's a lot of money that's out there for assistance to those who have really been struggling because of job loss, work cutbacks, not being able to go to work because your children are unable to go to school, whatever reason it is that you might be behind on your payments to your landlord, or as we said, on your utilities. There is help out there for you. This is unprecedented amount of money that's not only come to Erie County, but to those across the whole nation. So please go on that website, call that number, find out if you're eligible, if you're having struggles with there, and Charlie and ECCM employees are there to assist you. So thank you very much. We're now going to turn to the media for our questions today, and we're going to start with Erie News Now, and you can ask a question, of course, to me, to Char Beringer, or to Charlie Barber about the rental assistance program. Erie News Now.
Hi, good afternoon. A question to start for Char. Looking at our rise in cases over the last week and then rolling into the Easter holiday, where's your level of concern right now with variants now in our community, case totals rising, and a holiday where people generally gather just days away?
Thank you very much for that question. I know it's hard to not have gatherings with others outside of your household, but that's really, really what we need to stick to, unless you know that all persons involved have already been fully immunized. We're concerned that gatherings will be occurring that will facilitate the spread of disease over the weekend. Again, we have the power to keep our numbers down. I know it's hard. It's been over a year, but we really need to keep up these mitigation measures of limiting our contact with people outside of our household, keeping our distance, using our masks to protect others and to protect ourselves. Thank you.
And just to follow up on that quickly, at this point, many older people in the county, many at-risk people in the county have been vaccinated, although certainly not all. But does that temper your fears at all of a fourth surge, knowing that a lot of the most at-risk people have been vaccinated, or does that go out the window because of these potentially deadlier variants?
Well, the advantage of the older population being vaccinated is that hopefully we won't see a sharp rise in our hospitalizations and deaths. We know that our highest number of new cases is in the 25 to 49-year-old age group. And at this point, most of them have not received vaccine. So no, I don't think that those who have had vaccine already are going to influence our case count a whole heck of a lot. Thank you.
Thank you. And we'll go to Jet TV.
Good afternoon, Kathy. It's Star. I just wanted to get your insight on the state's announcement today about the vaccine rollout as we here in Erie County gear up for our tourism months and the months ahead in the summer here.
Well, the best thing we can do is to get shots in arms and as many people as possible in Erie County vaccinated, particularly as we go into some of our busiest months here in Erie County, and we have a lot of visitors coming to our community, and people want to get out and about and have a little bit more of a normal life. So I am very thrilled that the state was able to open up the vaccine to more coming up here in the month of April. The biggest, I think, challenge we are going to have is convincing some people to go get the vaccine. But there will be many, many more people vaccinated, I'm sure, by May and certainly by June, which will be a very good news for our community.
I guess following up on that, I would like to know, how were the conversations going with the state prior to this announcement today? Was there a push from your level down to Harrisburg?
I think there's been a push from across the state. Some of the vaccination agencies and entities that are doing those vaccinations have been having trouble, particularly in the last week, filling all of their slots. And so I think we were really seeing that we were kind of coming to the end of the really high need in the 1A category. Not to say that there still aren't people out there who are in 1A, but maybe those people have decided for one reason or another not to get vaccinated. So opening up to 1B, especially those people who are most at risk, starting today, firefighters, law enforcement, grocery store, and agricultural and food workers. That to me is crucial. Those people are on the front lines, have been for a very, very long time. And then next week, opening up to the next level, and then the next, and really within 3 weeks, everyone in Erie County who wants to get a vaccine and is 16 years or older should be able to at least get an appointment. So I think it's been a lot of conversations with a lot of entities with the state, but the state's also had greater supply. And that's really the thing that's been holding us back all along, is the supply of vaccine. So as more supply has come into the state has been making sure they push it out to the local providers of vaccine, and that's been a win-win for all of us, hopefully, going forward.
Thank you.
Sure. Erie Times News. David, are you with us?
Yes, Kathy, thank you. Sticking with the vaccine, do you expect, as the state opens up to 1B and 1C, do you expect that it's going to be as difficult to secure appointments as it was 6 or 8 weeks ago?
I don't think it's going to be as difficult, but again, people do need to be patient because there will be there's a lot of pent-up demand out there right now for vaccine of those who have been waiting their turn, and so I think we will see there may be some wait time, but the systems are more robust than they were a couple months ago. Every vaccination clinic has to have a number that you can call, as well as they've got systems now up for you to be able to register online. So I think things have just, in terms of the logistics of all of this, have been ironed out and should be a lot smoother as we have more people allowed to get vaccine.
And and I guess this question's for you and Shard, do you both feel, at least as far as the clinics that you're doing in conjunction with LECOM Health at the Bayfront Convention Center, do you feel that setup is going to be good for the next 2 months or so as we see the folks in phase 1B and 1C and phase 2 get vaccinated?
I'm going to have Shar answer that. Shar?
Certainly. Thank you, Kathy. Thank you. We'll certainly continue to use the Bayfront Convention Center as long as it's available to us. We are evaluating other sites throughout the county, looking for larger sites in the more rural parts of our county. I know some of those site visits were occurring this past week, so we certainly will not limit it to the convention center. But that is our most conducive site in the metro area for large volume clinics. And fortunately, we're getting the vaccine supply now to support these larger volume clinics. Thank you.
Thank you.
Joel with Talk Erie.
Yes, thank you, County Executive. This might be a good question for Shar here. Shar, do you have a good sense that our vaccine providers are ready for the general public by mid-April? At this point, we're only talking about a couple weeks.
I believe we are, because what will happen is the number of providers will be expanded also. There's plans to distribute much more vaccine to contracted chain pharmacies. So the CVS's, the Rite Aids, Walmart, Sam's Club, Walgreens, they're all going to be getting more vaccine than they have up to this point. So knowing that more providers will actually be receiving vaccine, yes. Again, not everybody's going to be able to get it by the end of April, but we certainly have a chance to get a lot more vaccine and a lot more arms more quickly than we have up to this point. Thank you.
And quick follow-up, can you give us any kind of feeling on how the outreach to underrepresented communities has been going? Are we hitting our targets that way?
We have very good relationships with our community partners, with the community centers, working with some of our rural communities, with our senior citizen high-rises and senior citizen housing centers, with the refugee community. MEDS is doing a wonderful job in addressing that, as are the federally qualified health centers. So I don't have solid numbers there, but we know that there is continuous outreach there and there is continuous provision of vaccine to this population.
Thank you.
Thank you. We'll go back to Ethan at Erie News now.
Hi, a question for Shar again. Obviously, off the bat, as we expand to phase 1B, 1C, and then into phase 2, it will really be a supply problem where we just don't have enough doses of the vaccine. But how long before this becomes a demand problem, where the greater challenge is not getting enough appointments, it's getting enough people to want those appointments?
That's a little hard to answer, Ethan, only because we don't really know what the vaccine hesitancy rate will be. Continuously throughout this process, though, we are educating people through the community centers. There is a team of community health workers that is pretty decent protection. And really, for us to get out from under these restrictions, we need people to get vaccine. And if that's their only motivation, that's a great motivation. Because the sooner we can get the huge majority of people in to receive vaccine, the sooner that the restrictions that we're under can go away. Thank you.
Do you worry about folks, well, I suppose especially my age, younger people who, for one reason or another, will kind of shrug this thing off and say, hey, it doesn't really affect us, or people this age don't tend to have as severe a cases? Will that be a big hurdle?
That population is always a challenge. There's no doubt about that. We'll certainly be working with schools. We'll be working with universities. We'll be working with training centers to make sure that those students know that they are eligible. For young adults, again, it's a matter of just letting them know it's available and see who responds. We can't make someone take the vaccine, but knowing that it will be available to them is very encouraging.
Thank you, Shar. Thank you. Star with Jet TV.
Yes, hello. I would like to know, in regard to this expansion, if there's any idea what kind of vaccines would be available. Could we see more of the Johnson & Johnson? I know the Department of Health was speaking to us about in phase 1B, we could see more of the Johnson & Johnson. Any update from the state about what that could look like in the next 2 weeks?
Shar, do you want to speak to that?
Yes, I can certainly speak to that. As far as the Johnson & Johnson vaccine goes, Pennsylvania was told about 3 weeks ago that we were going to receive 200,000 doses of the J&J vaccine. That didn't happen. We actually only received about 66,000 doses. And that is all that we anticipate receiving per week through the end of May. So with that in mind, there's not going to be a lot of availability of Johnson & Johnson. The best recommendation that we give people, the best vaccine for you, is the first vaccine that you can get in your arm. Whether it's Pfizer, whether it's Moderna, whether it's Johnson & Johnson, or any other one that gets approved between now and while this pandemic goes on. That's the best vaccine for you. Because the sooner that you can get protection for yourself, the better for yourself, for your family, for your friends, for our community. Thank you.
Thank you. David, Erie Times News.
Yes, Kathy, this question's for you. On top of everything else on Sunday, the mitigation efforts change, especially for bars and taverns. Bar service is going to be permitted. Larger percentage of maximum capacity is going to be allowed. You don't have to order food with every alcoholic drink. What are your thoughts on that? And is there a big concern we're going to see cases spike as a result of those mitigation reductions?
Well, I wouldn't be honest if I didn't say I have a bit of a concern as I'm seeing our numbers go up and the variant, the B1 variant, what they call the UK variant, take hold in our community as well as a lot of the northeast part of the country. So it's more contagious, as we know. People often, when they go into those type of establishments, aren't as careful. Obviously, you've got to take your mask off to eat or drink, or both. So the situation can be, I guess, more dangerous in terms of more risky, I guess should be the word, in terms of contracting the virus. So every person has to make a decision for themselves. And what are your risk factors? What are the risk factors of the people that you live with and have most of your close contact with? We are seeing certain food establishments. I've heard of this more in other places, but a little bit here too, where somebody has been out, they're not sure where they picked up the virus. So again, caution is what I would say to everyone. If you are fully vaccinated, you're probably in a much better place than if you are not fully vaccinated. If you have pre-existing conditions and you aren't vaccinated, then it's even a riskier situation for you, or if you live at home with people with those type of conditions. So of course, we want our businesses to be successful. We want them to be able to make money again and to provide all the services that we all want to have. But again, they've done a great job, our businesses, and I think they're going to continue to do it. And a lot of them are going to continue many of the mitigation efforts that they've been doing. They're really not going to change much. They're just going to let more people in. And so just think about your own situation, make your own decision depending on what your situation is my best advice.
Thank you.
Talk Erie.
Yes, this might be for you, Kathy, or Mr. Barber. We continue to have conversations on the radio show about the ongoing behavioral health pandemic, which some say will damage our young people, people in isolation, and elders for years to come. What specific steps are the behavioral health infrastructure in Erie County doing to address this parallel pandemic?
Well, I thank you for bringing that up, Joel, because we know that this is a huge issue. We know there's a lot of our children that haven't really been seen. Either they're not coming to school online or they're not seen once they are online, and there's a big concern around that. We know that suicide is an issue, drug addiction is an issue. There's just a lot of mental health issues that certainly haven't improved over this time, and many of them have worsened. So community as a whole is trying to put together the resources and make sure that everyone knows how to reach those resources, because we actually are a very rich county in terms of the resources we have out there for people. And I think that's the biggest thing, is how do we reach people and let them know what is available to them, and that help is there. It's just a phone call away often. And I'm going to ask Charlie Barber to speak to this a little bit further, because they obviously do a lot of work in this space for the county. So, Charlie?
Yeah, thank you, Kathy. As Kathy said, we have a very robust children's behavioral health system in Erie County. We probably get more financing into Erie County per capita for mental health than any other county in Pennsylvania. We have very top-notch providers. We have very good therapists and psychiatrists. The issue really is in the referral stage. So when COVID originally hit and it was essential businesses only, even though we were considered an essential business, people in the community weren't sure what was essential and what wasn't. And as they closed the schools, those were big referral sources that we would receive. So things are slowly picking back up. I would suggest that anybody who has even an inkling of whether or not COVID itself or for any other reason that you're not feeling that you're getting what you need or you're not feeling yourself, to contact Erie County Care Management. So once again, you can just go on our website, eccm.org, and on there you'll see a link to behavioral health. You'll find a link to autism. You'll find a link for ID. You'll find a link for managed care. You'll find a link for homelessness. Whatever your issue is, please contact us, and we will get a case manager contacting you. You probably, as you call, we'll be on the phone with you and start walking through the paces with you and do everything we can, everything possible to help you with your situation.
Thank you, sir.
So I would like to make a plea for vaccine along this line, and I'm going to tell of a story I know in Erie County where a nursing home, had opened back up. Loved ones were able to go back in and hug their loved one, and they wore a mask and they were very safe, but take their loved one outside for a little stroll, and be able to, again, connect. And we talk about so many of our seniors who've been alone and lonely for a year. Unfortunately, there was people who worked in that long-term care facility who decided for some reason they didn't want to get a vaccine. Someone came into work and ended up testing positive for COVID-19, and the whole place had to close down again for another couple weeks, according to, of course, state regulations, which is the right thing to do. But now, who suffers from that is the people who live there, the family members who have missed their loved one for so long. And so it's just another, I guess, plea to people. Think about you not getting a vaccine, what that could mean for people that you might come in contact with and pass potentially COVID-19 on to them and their loved ones. So it is certainly an act of generosity to your fellow citizens to go get the vaccine, and I do encourage people to do that for a multitude of reasons, and particularly for our seniors and the most vulnerable in our community. And we'll go back to Erie News Now for a final question from Ethan.
Hi, a question for Mr. Barber. With utilities now allowed to be shut off in April and moratorium on evictions ending probably sometime this year, just how great is the need for this rental assistance, and just how much good can this program do?
Well, I think the fact that we've been up and running for 3 days and we've already had over 600 people, so that's over 200 people a day that have actually gone all the way through and into the software system itself to start filling out the application indicates that there's a great need for it. And so, the more people we can get this information out to, and the sooner we can get the information out to them so that they apply, the quicker we're going to be able to resolve their issues, whether it's rent, whether it's utilities, or what type of utilities it is. We certainly want to help everybody that is eligible for these assistance programs.
Thank you. Star from Jet TV, do you have a final question?
Yes, I guess my final question is, as we move into this new phase and this exciting announcement for many today that have been waiting a long while, what's your word of advice for those that are going to be waiting to get this vaccine and hearing this roll out, but a numerous amount of people that want to get vaccinated coming up in the next 2 or 3 weeks or so?
I think my message is, first of all, there is an opportunity for you very, very soon, ahead of schedule. Thank you to everyone on the federal level, state, and local level who's helped to make that happen. So be very grateful, I guess, first of all, for the science in our nation and the leadership and the people who are really trying to get this vaccine to you as quickly as possible. Secondly, let's all just make sure, we have patience and kindness and respect for each other, knowing that it may still be a few weeks, maybe even a month or more before you can get your vaccine, but at least you know that there's a timeline when it's going to be open to you. And I think that's obviously very encouraging and hopeful news. And then my final message is, in the meantime, remember, this virus is not over. The pandemic is not over. It is still here, very present in Erie County. It wants to spread. It wants to find its next host. So as hopeful as we see, you're in this long marathon. The finish line may be getting closer, but we are not there yet. So don't give up the effort. Don't stop doing all the great things that you have been doing to protect yourself, protect your family, and your loved ones and your friends. Thank you, Star. David, Erie Times News, do you have a final question?
Yes, I do. I think this one's for both you and Shar. The way that the state is going to open this up, basically a new group each week for the next several weeks, in your opinion, is this a better way than simply having the state go, okay, we're done with 1A, now it's open to all adults? Is this a better way of doing it?
Well, in my opinion, it's a better way because now we actually have a plan. We know where we're going. It was often very difficult when new guidelines were just brought out and we didn't have any pre-warning that was happening, but this allows us to make plans. I think it's always better to know what your goals are and what you're trying to reach. And so I think the fact that we have a plan, a rollout, it's much easier for not only the health department and county government to respond, but I think for all those involved in this pandemic fight to respond. I'll see if Shar has the same thoughts or anything different. Shar?
I think it's certainly wise to allow a few weeks leeway to get the people, particularly in 1B, protected. These are people that have been frontline in the pandemic from day one. Really gives an opportunity for them to get in, get covered before it's opened up to everyone. So yes, it makes a lot of sense to me.
Thank you. And we'll finish up with Joel. Unless, David, did you have anything else?
No. Thank you very much.
Sure. And we'll finish up with Joel from Talk Erie.
Yeah, just another question regarding now that we're on this side of the vaccine where there's lots of supply, and are you anticipating some kind of communications campaign to promote the benefits of the vaccine, especially to those who are deciding to delay or maybe even forego it?
So obviously that's been something we've been talking about for a long time. The state and the federal level can do the best job of articulating that with the resources that they have, but we will be doing everything on a local level, kind of tying into the state messaging and the federal messaging to communities as a whole. But I think some of the best way that we can spread this news is for us, individual to individual. When someone expresses a concern about not wanting to get the vaccine, tell them about your experience if you've gotten the vaccine, and tell them why you think it's important. I think people listen to their friends, their neighbors, their family, sometimes more than listen to government. Shar, do you have anything else to say on that piece?
I'm okay, thank you.
I think you have stated it very well. Thank you.
So thank you. Joel, anything else?
No, that's good. Thanks so much.
All right, thanks. So I'm going to finish with just a couple of our star businesses. First is No Regrets Tattoo in Edinboro. They are taking appointments only. The door is locked. You can't just walk in. Checkout counters completely surrounded by plexiglass barriers. Capacity, masking, and social distancing signages are clearly posted on the front door. And I have one more business to talk about, and that is Jade Garden Chinese restaurant on East 38th Street, takeout only. The whole staff is wearing masks. Again, plexiglass barriers. They also have everything posted on the front door. So businesses that are doing a great job, as so many of our businesses still are, have been. When you go into the restaurant, the business of your choosing, and you see those signs, thank those business owners for doing that. Thank them for keeping our community safer. Thank them for keeping themselves, their employees, and you, their customers, safer. These businesses have gone through a lot over the past year, and I don't think we can really say thank you enough to them for all they have done for us. So as always, try to do your best personally to keep our community and yourselves and loved ones safe. Please continue to wear your masks over your nose and your mouth. Make sure it covers your whole mouth and nose when you're out and about and with other people that you don't live with. Keep that 6-foot distance from other people. Stay home as much as possible or close and out of crowds. And of course, if you feel sick at all, please do not go to work. Do not go out and about. Stay home. Monitor your symptoms. Get tested. Testing sites are listed on eriecountypa.gov, and find out if you do have COVID-19. It is that season of cold and allergies. I always say to people, think you have COVID first, get tested for that, and if you don't have COVID, then you know it's just your allergies and cold, but don't assume it's that first. In the meantime, please stay safe over this next week. Have a very blessed Holy Week, and for those of you celebrating Passover, also I wish you a good Passover and a blessed Easter. Thank you.
Thank you.
Welcome to WQLN PBS Homeroom. Hi, I'm Miss Julie, and today's lesson is about chocolate. Who loves chocolate? We do! Yeah, let's find out where chocolate comes from and how it's made. Come on with me. I would love to tell you a story about where chocolate comes from and how it's made. This is a great story that teaches us. It's called Cocoa Bean to Chocolate by Robin Nelson. I can't wait to find out. Do you like chocolate? Oh, I do too. Let's find out. Oh, he loves chocolate too. How is it made? Welcome to WQLN PBS Homeroom. Hi, I'm Miss Julie, and today's lesson is about chocolate. Who loves chocolate? We do! Yeah, let's find out where chocolate comes from and how it's made. Come on with me. I would love to tell you a story about where chocolate comes from and how it's made. This is a great story that teaches us. It's called Cocoa Bean to Chocolate by Robin Nelson. I can't wait to find out. Do you like chocolate? Oh, I do too. Let's find out. Oh, he loves chocolate too. How is it made? Well, cocoa beans grow. A farmer plants many cocoa trees. Hard pods grow on each tree, and inside each pod are seeds called cocoa beans. Wow. Let's see what they look like. Wow, look at that. Look how big they are. That's very interesting. Workers open the pods. The pods grow for many months. Workers cut the pods from the tree. The workers open the pods with a large knife. There are 20 to 50 cocoa beans inside each pod. Do you want to see what they look like? I do too. Let's see. Wow, look at what color they are. Didn't you think they were going to be brown like chocolate? No, they're white. Look at that. That's so interesting. Let's find out what happens next. The sun dries the beans. So that's the next step, isn't it? The cocoa beans are taken out of the pods. Then they are left in the sun to dry for many days. The dry beans are put into large sacks. So after, let's see what the picture looks like here. After they, they're They're spreading them out and the sun is shining on them. And let's see. A train takes the beans to a factory. A train takes the sacks of cocoa beans to a chocolate factory. A factory is a place where things are made. Okay, let's see. There's the sacks going into the train, and they're going to go off to the factory. The beans are roasted. The beans are cleaned in the chocolate factory, then the beans are roasted. Roasting the beans cooks them. It's easier to take shells off beans that have been roasted. Oh, so the beans have shells on them and they roast them and then they take the shells off. That's very interesting. I didn't know that. Let's see what it looks like to roast the beans. Oh, look at that. They're roasting them. Machines mash the beans. So the shells are taken off the beans, then the beans are mashed. Mashing the beans turns them into a very soft paste called cocoa butter. All right. And there it is. That's very interesting. Look at that. There's the chocolate. It looks like chocolate now, doesn't it? Now the chocolate is mixed. Milk and sugar are added to the cocoa. Oh. And it's the cocoa butter to make chocolate. The chocolate is heated and mixed for several days. Wow. So it goes under heat again and it's mixed for several days. That's a lot of days. Mixing makes the chocolate smooth and creamy. Very cool. Let's see what that looks like. Ooh, now it really looks like chocolate, doesn't it? Don't you want to just dip your finger in that? The chocolate is poured. The chocolate is poured into molds. Molds are containers that are used to shape things. The chocolate is cooled in the molds and it becomes hard. Wow. Oh, there's the molds. There they are. That is wonderful. The chocolate is wrapped. The chocolate is taken out of the molds. Machines wrap the chocolate. The trucks take the wrapped chocolate to the stores to be sold. And that's where we go and buy our chocolate. At the store, and that is a great story about how chocolate is made. I eat my favorite treat. How many chocolate treats can you name? All the chocolate. We'll have to name some of those later on in the lesson. I hope you enjoyed that. We're going to do a sequencing activity now to show you the pictures of everything that was in the story and see if you can find out the order. I hope you enjoyed the story about how chocolate is made. There's definitely certain steps that were taken, and it was fun to learn those. I have some cards. I made pictures of the steps on how to make chocolate. Now, I play this with my students a lot. We'll read a story, and then I make pictures, and they tell me what happened in the story first, second, third, and last. I have these pictures from the story I just read, and we're only going to use 2 at a time. And you're going to be telling me what happened first and what happened next, okay? And they could be in any order. So I'm going to mix them up for you. This is fun. And I'm going to put them out here, and you just two at a time. And I want you to tell me which one happened first and which one happened next in the steps of making chocolate. So here, the chocolate, well, actually, this is the cocoa pod being opened up. And these are the beans being dried in the sun. Which one happened first? Great job. This one did. Of course, you have to take it out of the cocoa pod to get them to dry in the sun. All right, now I think you know how this game works, right? Let's do some more. You might see those again. We'll see, because I'm mixing them up, and I don't even know which ones I'm going to put up. And there's one. And here's one. Let's look at those. Well, here's that cocoa pod on the tree, and then over here, the cocoa beans are being transported by the train. Which one happened first, and which one was the next thing, or happened later? Right, well, of course. Here it is on the tree. It's still hanging on the tree, and it hasn't even been opened yet. So this one is definitely first, isn't it? And this one happens later in the story. All right, here we go. Here's the chocolate being poured into the mold. And here it is being ground up. Which one happened first? Yes, they have to ground up the cocoa beans. Remember, they grounded them up, and then they put them in with to heat them up to make the chocolate, and then they poured it in the mold. So this happened later, right? So this was the step that happened first. This is fun. Are you having fun? And I can tell you're guessing the right answers. Very good. Okay, here, this one, they're spreading them out in the sunshine, okay? This one, they're roasting them. Which one happened first? That's right. They have to be in the sunshine and dry up a little bit. And this step happens later. They roast them. Remember that? Yeah, this is the next step after this. Good job. All right. Oh, that's a new one, isn't it? I'm going to try to find some new ones for you so you can see. All right, here they are being put in sacks. The cocoa beans are being put in sacks. And here, it's chocolate. Wow, good job. Yes, of course. These are the beans that are going to go to the factory where they're going to be roasted, and they're going to be made into chocolate. Okay, we're going to do one more. This one's going to be fun. You have to know this one right away, right? Of course. Here it is. This is the cocoa pod on the tree. And here is what happens at the end. Here's the chocolate bars. There's the candy. So this step in making chocolate is the very first step in the story. And this one is the very last step. I hope you had fun with that sequence game. And what I'm going to do next is I'm going to show you all 10 of these pictures in their order. Here are all the steps to make chocolate. Step 1 through step 10. Let's go back and talk about the steps to make chocolate that you learned in the story. Step number 1. The pod is grown on a cacao tree, and there's cocoa beans in there. Number 2, they take the pods off the tree and cut the pod to get the cocoa beans out. Number 3, they dry the cocoa beans in the sun. Number 4, they put them in sacks so that they can transport them. Number 5, there's how they transport them. They put them on trains to go to the chocolate factory. Number 6, the chocolate factory roasts them and takes the shells off. Number 7, the beans are now ground up to make a powder. Number 8, they add different things to the chocolate bean and they cook it to make chocolate. Number 9, they pour it into molds. The molds harden. The chocolate hardens in the mold, and look what happens. There's our chocolate that we can get at the store. And those are the 10 steps of making chocolate. Now I would love to sing a song, and the song is called Are You Hungry for Chocolate? And there's some pictures on the back of things that are made of chocolate I'm going to show you, and we'll sing a song about them. Is that okay? I would love to hear you sing along. And I'm going to use, this is called an eye gaze device, and this is how some of my students speak to me, with their eyes. Do you want to sing with me?
Want.
Do you want? Ready? Are you hungry? Are you hungry for chocolate? For chocolate? Are you hungry? Are you hungry for chocolate? For chocolate? When I point to you, I want you to repeat after me. Ready? We're going to look and see what's here. Oh, it's a candy bar. Oh my goodness, there's so many good candy bars too. Do you want?
Like.
I like it too. I like candy bars. Candy bars, ready? Yum, 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 yum. Are you hungry? Are you hungry for chocolate? For chocolate? Are you hungry? Are you hungry for chocolate? For chocolate? Let's see what I have next. Oh my goodness. Oh, chocolate cake, chocolate icing. Yum, 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 yum. Can you do that with me? It's fun. All right, I think I want. And I
Liking.
like, and I want some chocolate cake. Are you hungry? Are you hungry for chocolate? For chocolate? Are you hungry? Are you hungry for chocolate? For chocolate? Let's see what else is on the board. Oh, chocolate syrup. Oh, there's lots of things you can put chocolate syrup on, like ice cream. Oh, okay, do this with me. Yum, 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 yum.
Like.
I like chocolate syrup too. Are you hungry? Are you hungry for chocolate? For chocolate? Are you hungry? Are you hungry for chocolate? For chocolate? Let's see what else is on the board. Oh, hot cocoa. And they put marshmallows. Oh my goodness, that sounds so good, doesn't it? Ready? Yum, 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 yum. I hear you singing out there. Good job. Are you hungry? Are you hungry for chocolate? For chocolate? Are you hungry? Are you hungry for chocolate? For chocolate?
You.
I know you are. Me too. Here we go. Oh, brownies. Oh, chocolate brownies, especially when they're warm. Oh, ready? Yum, 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 yum. Are you hungry? Are you hungry for chocolate? For chocolate? Are you hungry? Are you hungry for chocolate? For chocolate?
Like.
I do like chocolate. Oh my goodness, chocolate donuts. Ready? Yum, 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 yum. Can you get your voice up that high with me? Are you hungry? Are you hungry for chocolate? For chocolate? Are you hungry? Are you hungry for chocolate? Chocolate!
You. Like.
You like? I like too. Let's see what else. Oh, chocolate milkshake. Oh, 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 oh. Yum, 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 yum. Are you hungry? Are you hungry for chocolate? For chocolate? Are you hungry? Are you hungry for chocolate? For chocolate?
Liking.
I like it. Let's say we're gonna skip a couple. Chocolate covered strawberries. Chocolate pudding. Ah. Whoa! Chocolate cookies with chocolate chips in it. That's doubly chocolate. Yum 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 yum. Are you hungry? Are you hungry for chocolate? For chocolate? Are you hungry? Are you hungry for chocolate? Chocolate. I know I am. And you know what? I had fun with you, and I'm glad that you sang along. Thank you so much for doing that. Now I would love to show you an activity, and all you need are candy wrappers. And I know this lesson is about chocolate, but it could be any candy. Save the candy wrappers. You need a piece of cardstock, regular paper's fine, or even a piece of cardboard off of a cardboard box would work. And all you do is you make a design on the paper. And what I'm doing is I'm doing the letter J for my first name, Julie. So that's what I started doing. But you can do whatever you want to. It can be a shape, like you can make a beautiful triangle or whatever comes to mind. It's wonderful. You can find this activity and a lot more on our Learning at Home page at wqln.org. So let me finish my letter J. It's fun because I can see what kind of candy these wrappers came from. Yes, and look at the pretty colors too. I love the colors. It's going to be so colorful. And you can also, it's kind of fun to look and see what kind of candy these wrappers were from. So they're going to try to pick it up for you. It's the letter J. Isn't this fun? Did you like it? Oh, thank you. I'm glad you like it. So it's so important, though, to recycle. And this is a fun way to use those wrappers instead of throwing them in the trash. I wonder if you can think of other items that you can use to make art instead of just throwing them away. I'll let you think about that. It was so much fun being with you today and having fun learning about where chocolate comes from and how it's made. So now, when you eat something made of chocolate, you can think about the wonderful book that we read together, Cocoa Bean to Chocolate. And remember, keep reading, keep learning, and keep watching WQLN PBS, where learning is brought to life. My name is Miss Julie. We'll see you next time.